What exactly is hormone restorations or balancing? Hormone restorations refer to the method used to bring hormone levels back to a balanced state. This can involve lifestyle changes, dietary adjustment, and personalized medical treatment tailored to your specific needs. One common method of hormone restoration is bioidentical hormone replacement therapy. This therapy uses hormones that are structurally identical to those our body produces. Many patients report feeling rejuvenated and more vibrant after starting BHRT. Commonest questions asked by the patients: when do you need hormone restorations or balancing? Hormone restorations or balancing may be necessary when you start noticing symptoms that indicate an imbalance and not reversible with lifestyle adjustment. For example, ongoing symptoms such as fatigue, unexplained weight gain or weight loss, mood swings, or sleep disturbances that disrupt your daily life. If you have existing conditions like PCOS, thyroid disorder, or diabetes and hypertension, it may be an indicator that your hormones are out of balance. At Anahu Clinic, we take a holistic approach to hormone restorations. We begin with a thorough consultation and assessment, which may include blood tests to check hormone level, focusing on the related hormones like thyroid hormones, sex hormones, and insulin levels, and an evaluation of your symptoms by discussing symptoms, lifestyle factor, and any related medical history. Understanding your unique hormonal profile is essential before proceeding with any treatment.